And we are live.
Thank you. Welcome, everybody, to Mesa Public Schools Facebook Live for the week of January 10th. I am so happy that you are joining us today. I am Holly Williams, Associate Superintendent, and I am so excited to have with me. And Tina, I didn't think to ask your title, so I'm going to let you introduce yourself so you say it right.
Sure. Hi, everybody. I'm Tina Mahoney, and I am the Resource and Education Nurse for Mesa Public Schools.
Thank you, Tina. So the thing that you need to know is why I didn't know her title is because I just go to her and she has all the answers. So I would have called her everything that I need to know. I call Tina. So thank you for being here. We so appreciate you and your expertise today. We're going to obviously talk about our COVID tracking. We're going to talk a little bit about vaccinations with you. We want to talk about mitigation strategies. And then we want to answer any of your questions around those topics. So we are happy to field your questions. If you put them in the chat, we have someone monitoring for us and sharing those questions with us, and we will get going. So Tina, let's just start with we have anticipated that most of our schools start back on Monday in a 5-person. In order to do that, we need some help from our community around mitigation strategies. So do you want to talk through the mitigation strategies? And while you do that, Ina, do you mind putting up the slide that we have that gives Tina some talking points on that?
Okay, so we can come at this from two perspectives. If you're an employee, we really need you to do your health attestation. This is not like any other year where if you have some mild cold symptoms or allergies, we can count that that's always what that is. So we want to make sure that we're checking in to make sure our employees are healthy and safe coming to school. As far as the community goes, we need you at this point in time to remember to continue to call into us and let us know if there's any cases so that we can help you and assist your families in tracking and let the administration know here so that we can make sure our dashboard numbers are correct and up to date for our important decisions moving forward. And as always, this might be repetitive information, but make sure you wear your masks, that you hand sanitize and wash your hands whenever possible, that you stay physically distant. And remember that we can do this together. We want to make sure to avoid large gatherings, especially if it's indoors. And right now there's the vaccine rollout. So those of you that are eligible and it's your turn to step up and get your vaccine if you'd like, please go online or make your phone calls and find out where you can get those vaccines. Because if we can all continue to do what we need to do and stay safe, we can get these kids back in school and keep them in school and do what we need to do.
You know, that's an important part, right? It's one thing to get to next week where we get them back in school, but we want to keep them here. And so keeping our community safe is very important. So if I'm a parent of a student and you're asking me to do a daily health assessment, let's just do a reminder of what I should be looking for and when I should send a student to school and when I shouldn't.
Sure. So a lot of times what you see this time of year are your regular cold and flu season, and we're still going to have kiddos that are showing symptoms of being ill, and it may not be COVID. However, during these times, we recommend that you keep your child home, make sure that if they have any signs and symptoms of being ill for any reason, that those are alleviated prior to student returning to school. If it's something that lasts more than 24 hours, especially if they have a fever, we really would suggest that you call your primary care physician if need be, or if you're feeling like this is something out of the ordinary and not something you would normally see with your child, we suggest that you keep your child home and possibly get them tested to make sure that they are not COVID-related symptoms. And it's really hard to tell the difference because many of the symptoms overlap. We certainly don't want kids not learning and not in school, but we want to make sure during this time that we're doing all we can do to keep all kids healthy.
We had great success with that first semester. I'd like to thank the parents who did their daily health assessments and erred on the side of caution and not sent sick kids to school, because that just kept us healthier. And, you know, we had many schools that didn't have any cases first semester or had very few cases. And we are also seeing fewer cases of the flu this year because we are following these mitigation strategies. So making those difficult decisions as a parent, whether to keep the child home in the morning, is so appreciated. We know that it's disruptive to work schedules and to just all activities in the home. But I think Tina makes a great point. If we can keep them home and healthy, then we can keep our schools open. So because if we send somebody sick into the room, right, we run the risk of getting
Absolutely.
others sick.
And Holly, I did just want to say too that if there's ever any question, or if a parent is home and they're really not sure one way or the other what they should do in regards to sending their child or keeping them home, the health office is open prior to kids coming to school. There's always somebody that's available. So call your student's health office and you can run it by the nurse or the health assistant in that office, and they'd be happy to talk it through with you. Sometimes just talking it through with somebody helps everybody to come up with a better decision that everybody's comfortable with.
That's a great point. Thank you for that. That's a really great point. One of the things I like on this graphic that we have up here to share with you is the idea that we can be good examples. And through our behaviors, we can model what we expect from our students, from our neighbors, from our coworkers. If we're following our mitigation strategies and we're talking about them openly, that we and it's visible that we're wearing a mask and that we're limiting our large gatherings. I think us as educators being the example, and the families that we serve as examples, that is powerful in a community. And I think we can turn the corner in Mesa to make things better for everybody and help reduce these numbers, because right now these numbers are very, very scary. And so we need all of your help. So thank you for displaying that, Ina, for us. That's a good graphic. Any of you who are interested in that information, I shared that last night in the governing board presentation that we made. And so that's available online via our governing board link. So, Tina, here's a question about vaccines. So we're going to transition to vaccines. We know they're rolling out, and we'll talk a little bit more about availability and such. But this is a good question around, do teachers need to quarantine after getting the vaccine so that they don't spread COVID?
Well, I will tell you there's a little bit of question about that in regards to Maricopa County. I don't know if those in the audience have listened to any of the webinars I've had. When you do get vaccinated, you get your first shot, then it's a 21 to 28 day time frame before you get your second shot. Once you receive your second shot, it's about a 10-day period after that before you are considered to the immunity of whichever shot you got. For instance, the Pfizer is, I think, a 97%, the Moderna is a 94%, and then it goes from there as they come rolling out. You are not 100% immune. So right now, and Maricopa is double checking this, as is the CDC, to see what they want to suggest for quarantine. Just because you have a certain percentage of immunity does not mean that you cannot get the virus or pass the virus to others. So because we know that fact, we are saying that even if you have the vaccine, you need to follow all the mitigation strategies. So you still need to wear your mask, you still need to physically distance, do everything that we talked about previously. As far as the quarantine goes, for our staff, we are saying if you have been vaccinated and you've received both vaccines, right now, Maricopa County and the CDC are suggesting if you are ill and it's not 24 to 48 hours post-vaccine, receiving the vaccine, they are saying it's probably not vaccine related. If you have symptoms for 48 to 72 hours, they are saying, especially if you have a fever, they're saying you should follow up with your primary care physician and have that discussion with them if they feel like you need to get tested for something more, because you could have been exposed even though you've been vaccinated to the virus. So at this point in time, they are continuing with the quarantine rules of 10 days, even if you are vaccinated. However, like I said, that is something that they are double checking right now. And as we always say with everything, stay posted and be on the lookout for more updates, because we make sure, and the administration here in Mesa Public Schools is on the line with our county health department and Arizona Department of Health, probably once a week at least on a regular basis, getting those updates and making sure we're giving you the correct information. So at this time, what we've been told is even if you have the vaccine, they're still going to support the quarantine, because we can receive it or get the virus and we can pass it along. And we have to think about those around us that have not been vaccinated yet. So that is the latest news I've been told.
And I think you made a really good point is we try to stay as up to date as we can, knowing,
Hmm.
excuse me, that knowing that this is an ever changing landscape because the
Right.
vaccines are brand new and everybody's learning together. So as they know more and share more, then we adapt our procedures and practices
Hmm.
to fit the new knowledge. So right
Correct.
now we're going to follow exactly as Tina said, and then as we know more, and as folks get their second vaccine and we see the impact and we see how many people do get the vaccine. I do have a question and that I'll take around, are we requiring the vaccine? We are not at this time requiring the vaccine. We are suggesting and strongly encouraging anybody who feels like it's the right decision for themselves that that's what they do. We think that this will help keep our community safer. So we are very much in favor of folks getting the vaccine, but it is not a requirement for our employees at this time. Um, so I want to talk a little bit about contact tracing. We have some questions in here about contact tracing and how do we know if folks aren't reporting and what we do about it. So I'll take a little bit of it, Tina, then I'll throw it to you. But let me
Sure.
just talk how we have what we call the contact. We have a COVID tracking team on our staff, and it's made up of myself, Nadine Miller, the director of health services, some folks from HR, and so, just a group of other folks who come together every week and we talk through our tracing. But let me talk to you about how we do it on boots on the ground day to day. So we have a form that our school nurses have that every case that's reported to them comes into a central database. So everything is gathered. So we can know the case counts at a school. We can know when the positives happened. We can track it by week. That's the data we use for our dashboard week to week. And so it's important that we continue to have those reports. The other thing that we get is information from the county. So, Tina, do you want to talk to us how the county and the contact tracers work with us in that way?
Absolutely. We have specific names that are assigned to us here in Mesa Public Schools of contact tracers that we can access throughout the day. So any questions we have on a regular basis, we can call and always reach somebody at the county to ask them the questions we have. We have received many calls here in Mesa Public Schools, and then what we have done is done our online forum to Maricopa County, which registers that person's name in. Many times they have the name somewhere in their system already because they're getting the information as well from the other end of the testing site, but it might be a little bit delayed depending on the numbers that were tested on the same day those kids were. So usually the numbers that they're getting from us are more up to date than what they have in their system because we're getting the information to them quicker than the actual test sites. And then what happens from there is they will ask us specific questions as to close contacts or family members. And when and if we have that information, we share that with them, not only on the forum, but in the follow-up phone conversations that we have from them. And then they will suggest to us through conversation and through the information that we provide to them what they feel like is the best option for whatever the situation is that we have. So for instance, right now we are virtual and the decisions are being made as to what's going to go on from here. But from Christmas vacation to this point, we've just done kind of the reporting piece of it. We haven't had to do much follow up on our end because kids are not really back in school yet, other than our on-site learning kiddos. And again, if one of those children were to show up positive or a staff member were to show up positive, then like always, we would approach that situation and offer suggestions on what to do with that situation based on our conversations with the county tracers. So we really are in a good partnership with them, and through good conversation, timely reporting, and I would say transparency, which is really important. We come up with the best decision for each of the situations because, as we know, and as we've seen with this entire process, things change so quickly. And, if you have a kiddo that's at home and virtual that's not attending on site, that's going to be very different than somebody that's in a face-to-face learning situation. Or if you have a preschool kiddo that does not wear a mask, and they are in a large gathering of children and they don't wear masks, that may be a different way of that gets handled than a situation where you have an older sibling who's in a class, maybe same family, but they all wear masks. So each case and each situation is going to be handled in a very individual manner that best suits the needs for that situation.
And so you've heard us on this Facebook Live for our audience. You've heard us say student by student, classroom by classroom, school by school. And exactly what Tina described is what we do. We literally take each case and we say, okay, what else is happening in that classroom? So I've had a question about what about parents who don't report? So let me talk to you about how we handle that. Um, in my world, it would be my preference that every parent report everything, and that's what we need to make the best decisions. But I will tell you, we are able to do some anecdotal tracing, even if a parent doesn't report, but they're doing the right thing by keeping their children home. So let me give you a circumstance. A family maybe has 4 children. 2 of the older ones have tested positive, so they know there's COVID in the house, and the 2 young ones, you know what, they have the same symptoms and they're sick. And so the parents make the decision not to test those students, but to keep them home and keep them safe. That's not a bad thing to us because they're doing what we ask. They're keeping them away from our school, and they're making sure that they're not exposing other people. But anecdotally, we know from the principal or through the nurse that those are the things that are going on. And so we can use the information we have. It may not count as a positive on the dashboard, but we can use that information to drive our decision making. And so we could say, well, I know that there's 5 students in that area who are positive, and 2 others who are probably positive because their family members are or have had a close contact. And so we need to make a decision about that team or classroom or whatever based on all of the knowledge we have. So while you might be seeing the dashboard that has a number of positives, we are using all of the information we have to make the decisions about the classrooms day to day, week to week. So please know that I'm never going to say don't report and I'm never going to say don't test, because I think those 2 things are very, very important. But I understand there are circumstances by which that's not possible. But as long as you're following the mitigation and you're keeping your student home when they've had a close contact and or are sick, to me, that's helping us keep our students safe, and I appreciate that. So I don't want to discount the knowledge that moms have about what's going on in their house. I understand that, and I appreciate it. So, but I will tell you that positive tests help us make the best decisions. So encourage you to report and to have the just let the nurse know what's going on so that they can help you and give you the resources that you need. I was going to check and see if I had another question here, Tina, real quick. Let me just look down. So there's been a couple questions about the vaccine and who can get it. Do you want to talk about the phases and then the age groups also that are eligible right now?
Sure. Right now we are in finishing up phase 1A and moving into 1B. Right now, 1A is your first responders, your healthcare individuals, police, fire, essential workers that are hospital related. 1B is more of your educationally based essential workers and anybody, I believe it's over 75. I don't have the form in front of me, but at 75 or older. And then other essential workers as defined through Maricopa County, which is food, utility, and transportation. So it is a large group, and I do feel like even though there's been some glitches with their sign up website, it will move quicker than people think it will move. And we have a lot of partnerships that are opening up and jumping on board to say that they want to help this group because our school partners, Mesa Fire Department, Cigna Healthcare, the local hospitals have all said we feel like it's really important to get educators and those that work in the education system vaccinated because we want our kids back in school. So we think that this phase may go a little bit quicker than expected. And I know Arizona Department of Health Services, they've opened up the new pod now down in Phoenix, which is a 24/7. You can go on that website, AZDHS, to sign up, or maricopacounty.gov. And just keep in mind that because of the traffic and because of the number of people signing up, which is an amazing thing, we want that, there may be some delay time, there may be some lag time or glitches with the website, but if you keep going in, something will open up for you. And then from here, I think we will move towards 1C fairly quickly, and that's going to open up to a great number and amount of the population. And I think some of that may go through your Walgreens and your CVS and your local pharmacies. So as much as we've seen a few hiccups in getting everything started, I really think that this will go much quicker than expected as long as a vaccine is available, and it's looking like it will be. I think Arizona especially, and we here in Mesa, we have put a priority on this is really necessary. We need to keep everybody healthy and safe, and we want our employees to feel comfortable and safe coming back to school. So we're doing everything we can on our end to make that happen. And that includes lots of discussions with Mesa Fire in our partnership with them to try and get something set up for our Mesa schools.
Yes, for our employees. Now, if I remember correctly, this set of vaccines, it doesn't have anything to do with the phases, but the age group that can get them. If I'm remembering right, it's 16 and older for one and 17 and older for the other. Does that sound right?
I believe that the Pfizer they were saying is 17 and older, and I believe the Moderna is 16, but I'm not positive on that fact yet. But it's
so right now the vaccines aren't for young
older
children.
No.
That's right. That's right.
Yeah.
And they are working on that. It's just currently these current vaccines that have been approved are not for younger children
not for
yet.
the younger kids. Right.
Yep. Okay. So I have another question regarding the data for the dashboard, our parents reporting, and I'll tell you that we had some meetings yesterday with all of our leaders, and we asked them to push out for another ask to make sure that we had accurate data, and we're seeing quite a bit of data come in this week. We have all along, once we reopened, families have been really good about letting us know that they tested over break or they've tested in the last 2 weeks, and we've gotten that information from our employees and our parents. So my answer to that is I think so. I think we're doing pretty well there. I feel like the reminder yesterday and today has helped generate some more reports. We saw a little busier day today. So I think that reminding people that even though we're not in person, we do need the information about testing and the results, whether it was positive or negative, is important for our database. So thank you for that question, and thank you for that reminder. I have another follow-up question. What about when are we going to know about schools reopening next week? And I'll take that one, Tina, because we've been working on that quite a bit. So we plan to reopen to in-person learning next Tuesday. Remember, Monday is a holiday for MLK Day, and which is celebrated across the state of Arizona. So we have no school on Monday. It won't be a remote day. It will be a no school day, which one of my children said, really? There's no school Monday? So I'm pretty excited about that in my house anyway. And so Tuesday, we will begin back to as often as we can in person. And when will you find out how your school is affected or your classroom? Our plan is to have the dashboard loaded by 1 o'clock tomorrow. And if you remember before break, I shared with you some changes that would happen to the dashboard. You're going to be able to see what learning model your school will be in on the dashboard. So that'll be a change that we wouldn't have had before. So for instance, if a school stays remote because their case count is such that it's concerning enough to keep them into a remote setting, it will be indicated on the dashboard. So tomorrow by 1 o'clock, the dashboard will be loaded and you will know what learning setting your learning model your school will be in. Additionally, you will receive a letter from your school tomorrow afternoon giving the specifics about that, whether it's the 5-day model and what that goes, it's kind of a welcome back to the semester type of letter. If you're in remote, what does that mean? Or if you're in the modified 2-day, which would be the AB schedule that we started the school year in. So there are 3 models that you can be in. Those decisions are being made as we speak. We're working on that, and we plan to share that tomorrow by 1 o'clock. You'll see the dashboard and then the follow-up letters. So hopefully you will know and be able to make plans over the weekend that fit your family and the needs that you have. So there's some talk about case counts in the state versus case counts at the school, and how can we be okay with opening? So Tina, do you want to talk a little bit about what we've seen in the fall, our experience as far as when we see a high case count in the neighborhoods and what it's been looking like in our schools?
Absolutely. Yeah. What I've told everybody, because I've had that question come up from our end in health services as well from our staff. And what I have told them is we look at not only our internal dashboard, the Mesa Public School dashboard, but we look at the Maricopa County dashboard. We understand that case numbers across the board are high right now. In our entire district, the numbers are even high. But what we try and do is we try and look at the zip codes, and then we look at the schools within those zip codes and say, are the schools reflecting what we're seeing in those zip codes? And if yes, then we look, should we be looking at making the school a modified schedule, a complete virtual schedule? Are we good to go back face to face? And remember, even though we've been face to face, parents have had the option since we've been back in school to have a virtual learning environment. So that we've always made sure that that choice has been there. But for those schools and parents that have chosen to have their kids back in school, we really want to make sure that we're doing our due diligence at looking at the full picture. If we have a number of cases at a school, for instance, before break, I think many of you, if you were watching our dashboard, knew that Mesa High had been on kind of an A-B type of schedule. The reason for that was because in conversations with county and our administration as a team, because it is a team and a partnership, if we're going to go through this, everyone decided that it was in the best interest of the school, the staff, and the students to have them on a hybrid type of model. Um, in addition to looking at the school, we were looking at the zip code at the time, and they happened to be in a very hot zip code. So we really do look at the big picture. And because Mesa Unified School District is such a large district, you could be looking at, like an Adams zip code versus a Salk Elementary zip code, and be seeing very different pictures. But because we are within the Mesa School District, we are all under the umbrella of the numbers that are being reported to county. So that is why, as Holly said earlier, we really encourage parents to call and let us know those things, because those numbers that are on our dashboard help us in the long run make a decision in conjunction with Maricopa County numbers and the staff at Maricopa County to what is best for the individual schools, as opposed to the entire district. Because like I said, we are so large that you're going to have some schools that might be on the north part of Mesa that are doing great and have low numbers versus some schools that are at the south end of the district that are maybe in hot zip codes and not doing so great with their schools. And again, some of that depends as well on where we're seeing those numbers. For instance, in first semester, we saw some of the sports teams where we had a large number of positives on a particular sports team. And we don't take, making decisions about closing anything down lightly. And we want to make sure that we're always bouncing it off each other and using Maricopa County as our springboard. So please know that when our administration makes a decision, we're always relying on the information that we share and get from Maricopa County to make sure that we're doing what's in the best interest of everybody. So that's kind of how we use the numbers. And I think it really has done well for us so far, because, when you look around the state, and there's a lot of districts that have not been back to face-to-face learning at all. And we have really tried to meet the needs of all of our students by looking at the individual cases and the individual schools.
You gave good example there of sports teams. We've had to quarantine sports teams and shut them down for short periods. We've also done that with individual classrooms, depending on the circumstances. So we try to make the best decision for the circumstances that we're faced. If we see it in a community, then we know that we need to put the school back into remote. But mostly we take a look at it, like you said, those layers, right? We talk together and we decide, should this be the answer or is this a better answer? And we work with the school principal, any of the leadership team on that school, and then our health team here to make those decisions. I have a question for you that I don't know if you have an answer for, but I'm gonna throw it to you. Do we know a timeline for getting the vaccines into Mesa? You talked about the partnership with Mesa Fire and things like that. Do we have an indication? Are we 3 weeks away? Are we 4 weeks away?
I would say we're probably 2 weeks away. I know we have the go ahead to do the partnership and to set up a pod. I think they're just waiting on the final word of how many vaccines we will get. And if you're a Mesa Public School employee, please pay attention to your emails. A survey went out to see if there was interest. If you were offered the vaccine, would you get it? And we need those numbers back so that we can determine how much vaccine we may need, how to set up the pods, and how that will look as far as the rollout goes. We do want to remind everybody that if you are set up to get your vaccine, or if you have already received your vaccine from one of the community pods, for instance, the Chandler Gilbert or the Phoenix pod, if you've already received your first dose, you must go back to that pod to receive your second dose. So don't cancel any appointments. And right now, until we have everything confirmed with Mesa Fire, if you can get in with one of the other pods sooner than later, we suggest that you do that, because there's no guarantee on the number of vaccines we're going to get. And as much as we want to be able to vaccinate everybody, we're going to need these community partnerships to make sure that everybody is done.
Yeah. And because we don't have a date, we want to
Right.
really encourage folks to keep the appointments you have if you can.
Correct. Yep.
Because we know that if they made the appointment available in those other pods, that means they have the vaccine available there. So they're only opening up as much as they have available. So
Yes,
that's a plus. I'm going to take one more question and I'm going to answer it, and then I'm going to say thank you for today. But we have a last question is around, what if I chose remote in the spring, or I chose in person, in the fall semester, and now I want to change my choice for my child? You can reach out to your school. I will tell you that we based staffing on what the choices were made in the fall. And so there is limited availability to change your choice now because of, we really worked hard over the last several weeks of the fall semester and over break to make sure that a teacher is not teaching both remote and in-person kids at the same time. So we have remote sections and we have in-person sections across our system. So we're trying to do that as much as possible. And the way to maintain that and to keep the class sizes, we had to have those numbers early. So that's why you were asked in the fall that question. If you want to make a switch, you can reach out to your school. I do know some schools are doing wait lists for people. If one switches one way, then they make a wait list and they do it. But I'm not sure of the availability at school by school right now. So, and I know it's very limited at this time. So I want to say thank you to Tina. Thank you for joining us
You're
today. I
welcome.
appreciate you being here. You had great information to share, and hopefully we got to most of the questions. I know I didn't get to all of them, but hopefully we got most of the questions our community was wondering about today. So thank you for joining us on Facebook Live from Mesa Public Schools. We hope to see you next week. We will be talking again. Hopefully Dr. Forrest will be able to join us and have some more information to share. So there is more information available on the websites that Ina's going to share. And thank you all, and have a great evening.
Bye.
Bye.